So welcome to our highly riveting presentation on metformin today. Our case study is on a 43-year-old single female, Margaret, who happens to be a office administrator who leads a somewhat sedentary lifestyle. She also participates in a monthly book club, which happens to be the only riveting thing about this presentation. Her family history is riddled with obesity, cardiovascular issues, high cholesterol, and type 2 diabetes, mellitus. In the last 10 years, Margaret has been diagnosed with high cholesterol, obesity, and has begun to show signs of cardiovascular conditions. In the past 12 months, Margaret has also been diagnosed with type 2 diabetes mellitus, unfortunately, and informed by her local GP that she must improve her dietary intake and exercise levels. Subsequently, she has begun to walk 3 or 4 times a week for approximately 30 minutes, and it's important to note that she hasn't experienced any prior issues to her feet. So she presented to a local GP after walking with a friend just for a regular checkup, upon which a blister was identified. He proceeded to drain and dress the blister and instructed her to monitor her healing and keep the site clean as possible, obviously to reduce the risk of infection. However, 3 months later, the issue has intensified and the wound has developed into an ulcer on the plantar aspect of the left foot under the fifth metatarsal head. Upon presentation to the podiatry clinic, we noticed that Margaret's feet were cold and that it was clear that she had a reduction in sensation in the area. Margaret has outlined that she has been taking 3 medications, obviously because of the list of conditions. Lipitor, which is a statin for high cholesterol, furosemide, which is a loop diuretic for edema, and lastly she mentions metformin, which is for her diabetic management. So why metformin? Metformin is basically being used for type 2 diabetes. It's a trading name of Diabex, and this is a biguanide that helps control blood glucose levels. Metformin is used for type 2 diabetes and is actually not suitable for type 1 interestingly enough. It is used in the combination with insulin and often with other medications such as sulfonylureas, and sorry for that pronunciation. But nonetheless, the most beneficial side effects is weight loss, which is quite specific to Margaret due to her, weight issues. So basically the pharmacokinetics will obviously look at absorption, distribution, metabolism, and excretion. So in tablet form, metformin is absorbed over a 6-hour period. This allows a bioavailability of about 50 to 60%. The VD is 63 to 276 litres, and the main sites of concentration without accumulation are the salivary glands and the intestinal mucosa. Metformin isn't actually metabolized with a half-life of about 6 hours. So following on from pharmacokinetics is obviously pharmacodynamics, and this is actually a tricky one because the mechanism of action is unclear. However, it's thought to work in 3 ways. Firstly, decreasing hepatic glucose production. Secondly, improving the insulin sensitivity in the muscle. And also delaying intestinal glucose absorption. Metformin acts on glycogen synthase and stimulates intracellular glycogen synthesis. It also increases the transport capacity of all types of membrane glucose transporters. So obviously with the amount of drugs she's taking or medications, there's going to be some sort of drug interactions. Excessive intake of alcohol. Whoops, I think something happened here. Excessive intake of alcohol may increase the risk of hypoglycemia. The use of loop diuretics may increase the risk of lactic acidosis. And lastly, metformin shouldn't be used when conditions such as heart failure are present, except in special circumstances. And given that there are potential negative drug interactions, it may suggest that Margaret be referred for counselling to emphasise the risk of her behaviour. So clearly we want an outcome. Metformin has been effective it has been effective for the management of diabetes. Since beginning the use of therapy, she's also lost 12 kilograms. However, there is reason for some concern as some of her behaviours suggest that she may not be considering the significance of the condition or the severity of that, especially with the continued use and abuse of alcohol. Further to this, it appears that the drug interactions have not been carefully considered by Margaret's treating physician, and there is a potential for the cause of this to cause serious issues. Overall, the effectiveness of metformin has been a positive one at that, and there is scope still for greater improvement in counselling and further podiatric intervention, which is good. It gives us a job. But unless you don't have any other questions, which we really hope you don't, thank you for having listened to this presentation on metformin. Thank you.